Okay, so I've gotten a picture from our textbook of Kelly and Peterson, and I want to replicate a picture like that, but I'm going to simplify it to make sure that it's easy to draw in an examination situation. Because as well it is, and nice as it is to say that, oh yes, I'm going to draw exactly like the textbook, there are many images that we must learn for our examinations, but to be a smart studier, I think it's easy to choose and to select what things you're going to remember. So in the selection process, I have eliminated some things that I think are not important. Sorry, they are important, but they are probably not essential in a drawing. Because then again, when we say that when we go into an exam situation, we must show them how much the extent to which our information and our anatomical knowledge is prevalent. So I'm going to draw now, if you follow with me, I'm going to show you a do-it-yourself way of drawing a cut of C6 in an exam situation. So I'm going to start, and I always do, with the vertebra. Excuse me, I'm not a very good drawer, so you're just going to have to work with it, if that's alright. That's the vertebra. Then we've got here inside the vertebral body. Then we've got the vertebral artery on each side. Must never forget that. Then we have many many muscles in the back, the erector muscles, which pull the back together. I'm not going to label them because it's as I feel it's not important to remember each one, and even in some textbooks they just collectively call them erector muscles. Then we'll remember, we said before, the trapezius muscle. The trapezius muscle is quite important, so I'm going to draw all of the trapezius muscle in the back. We then have the levator scapulae muscle, which is on each side. So it's like a symmetrical image, where in the middle, this is on each side, it's almost the same now. We then have the esophagus, here in the middle, and I'm assuming that it's full with food and bolus at that present time. I'm then drawing the trachea, and the trachea has the thyroid cartilage, thyroid gland, around it, so it loops around it like that. So like we said, esophagus, so vertebral body, I'm sorry it looks a bit crooked. We have the esophagus, and we have the trachea, and we have the thyroid gland. We then remember the big sternocleidomastoid muscle. We're going to draw the sternocleidomastoid here. Next to the thyroid and the sternocleidomastoid, we have two things here. Smaller and a bigger one. I'm going to draw them on each side like this. This is the internal jugular vein, and this is the external jugular, the common carotid artery. So internal jugular vein, common carotid artery. Internal jugular vein, common carotid artery. Remember that the common carotid artery is a bit smaller than the internal jugular vein, and you want to show your examiner that you know that. We also have the external jugular vein, which lies even more anterior to the sternocleidomastoid muscle. Okay, and now that's probably how I would end it. I know that there are other structures which exist in this area, but I would stop it there just for the sake of remembering things for the exam. I would then draw a big line outside to end it, so excuse that. And then I would go to label each area. Draw a line, I do a dot like this, so I know exactly what I'm talking about. Exactly where I'm pointing, because I know some arrows can sometimes be a little bit deceiving in knowing where they are. So there, we click thyroid gland. We then have here, trachea. We then have here, sternocleidomastoid. We then have external jugular vein. We also have internal jugular vein. We have common carotid artery. I'm only going to label one side, and you only need to label one side. We've got the vertebral artery. We also have the levator scapulae. We have the trapezius muscle. We can call these collectively the erector muscles. And I think that way we've covered, the esophagus here. And that way we have the drawing. I know it doesn't look as nice or as detailed as the other image that we have in our textbooks and on the internet, but that's probably a more realistic image and a realistic drawing of how to draw it. So I've drawn the vertebra first, and that's what you should always do. And remember things. So that's behind it, the muscles that lift up the back, the erector muscles. We've got the trapezius at the back. We've got the levator scapula. Same thing. It's almost symmetrical. Esophagus, trachea, cartilage, thyroid. We've got the common carotid, internal jugular vein. We've got the sternocleidomastoid. We've got the external jugular vein, and it's quite symmetrical in its way. So that's it.